I'm going to talk about prejudice in relationship to obesity, which I think is sadly still an extremely common issue. I actually quite often examine my own views and beliefs and prejudices, because I think that it's very hard to divorce some of these aspects from the enormous barrage that we get from the media, from politicians, from our colleagues. And I think in relationship to obesity, I would argue that it is still one of the last bastions where expressing prejudice is still socially and even professionally, dare I say, considered acceptable. So let me just start off. What are your attitudes towards this patient? What would be the labels that you would give if you were trying to tell your colleague, oh, I've just seen this new patient, she is ... How would you describe her? When the patient comes in, would you have the right equipment in the consulting room for this person to sit down comfortably? Would you have the right size blood pressure cuff? Would you even have scales which would weigh her? I can tell you the number of times that I have patients who are told, oh, well, we'll put you on 2 scales with 1 leg on each to see what you weigh. So the issue is very, very stark, I think, as to what would you do when you're approached with this patient. Compare it to how you might approach this patient. What would be the labels that you give her? How would you describe this patient? Would weight come into your description of the patient even? Would you feel that this patient deserves your best care and your best efforts? And do you think that you would approach or treat or handle, if you like, this patient differently to the person in the previous slide? Well, of course, as many of you will have probably recognized, this is the same patient before and after weight loss on bariatric surgery. And you just have to talk to patients who have moved from here to hear their story as to how people treat them in a totally different way. And I think that is, if you like, probably the strongest evidence almost for the fact that prejudice is still rife.